Good morning, students. In continuation of the chapter A Treat for Mosquitoes, I will discuss about anemia disease today. Let's begin. We all have a fluid which is constantly circulating throughout our body called as blood. Our blood is red in color. Do you know why? Blood has its own components like red blood cells, white blood cells, platelets, and the liquid part is the plasma. Due to the presence of red blood cells, blood is red in color in human beings. Each red blood cell contains hemoglobin. This is hemoglobin. Hemoglobin is an iron-rich protein which can bind oxygen and give blood its red color. When there is decrease in the number of red blood cells in our blood or decrease in the quantity of hemoglobin in the blood, it leads to a disease called anemia. So, anemia means lack of blood. One side of the picture is shown with normal amount of red blood cells and the other one shows low amount of red blood cells in the blood. The normal ranges for hemoglobin depend on the age of the person. The normal ranges are for newborn babies, it is 70 to 22 gram per deciliter. For 1 month babies, it is 11 to 15 gram per deciliter. For children, 11 to 13 gram per deciliter. For adult males, it is 14 to 18 gram per deciliter. For adult women, it is 12 to 16 gram per deciliter. For men after middle age, that means after 50 years of age, it is 12.4 to 14.9 gram per deciliter. And for women after middle age, it is 11.7 to 13.8 gram per deciliter. Now, what is anemia exactly? Anemia is a disease caused due to the deficiency of red blood cells or hemoglobin in the blood. How can we detect anemia? A blood test helps to identify the count of the number of blood cells in a sample of our blood including hemoglobin. For the detection of anemia, a syringe full of blood is taken for the complete blood count. Iron deficiency anemia signs and symptoms are extreme fatigue, weakness, pale skin, chest pain, fast heartbeat or shortness of breath, headache, cold hands and feet, inflammation or soreness of your tongue, etc. Now, what are the causes of anemia? There are various causes of anemia. Some of the causes mentioning here are dietary deficiency, which includes low intake of iron diet, vitamin deficiency like vitamin B12, malabsorption like where the body is not able to properly absorb or use the nutrients in the diet. Some chronic diseases like cancer, kidney disease, inflammatory diseases, arthritis, etc. How can we prevent ourselves from this disease? One should take iron-rich diet like raisins, sesame, nuts, pulses, apple, amla, banana, jaggery, vegetables, green leafy vegetables, etc. These are highly rich in iron. One should also take healthy diet rich in vitamin B12 like mushroom, milk, fish, egg, meat, shrimp, cereals, etc. One must visit a doctor for regular checkup. Anyone at any age can get anemia disease. Children suffer a lot due to anemia. It has been seen in children that anemia affects the physical and mental growth of children. It affects their ability to study properly. They lose concentration in studies due to fatigueness. Daily physical activities like games and sports cannot be played for long due to weakness. They also have weak memory. So, it is advised to all the growing children to have proper or a balanced diet, especially rich in iron, so that their hemoglobin level in the RBC of blood may remain adequate to live a healthy life. Thank you, children.